are back with Alan Gordon, who claims most pain is in your mind, and orthopedic spine surgeon, Dr. Hooman Melamed.
Alan, coming back to you. You say that doctors are treating chronic pain all wrong, and the issues goes back to the lack of training in medical school. Tell us about that.
You know, Felicia, the woman we just saw, was diagnosed with a 4-millimeter disc herniation in her neck. She had a lot of pain around that and a lot of fear around it. So all we did was we helped to teach her brain to reinterpret these sensations as safe, and the pain went away. That was 4 years ago. She's still pain-free. I have a lot of respect for physicians, but there is a fundamental misunderstanding of chronic pain in the medical community. We need a paradigm shift in the way that chronic pain is treated and understood, and we need it now. There's just too many people suffering.
Yeah, well, that's a very interesting point. Dr. Melamed, to you, you disagree with what Alan says about the lack of training for chronic pain. Is that right?
I think, yes. I mean, I think we learn about pain, from, you guys know, from first 2 years in med school, we learn about pain receptors, the pharmacology. So we understand that. And then during the 2 years in medical school, our last 2 years, we're on rotation. Every rotation, I mean, we have patients who have pain of something, some kind of pain, something. So we are familiar with the pain. And then we all go to our respective residency, whether it's plastic surgery or psychiatry. I mean, there's impossible for a patient not to be seeing us because of pain. But I do agree with Alan that we do need people understanding more about the psychology of the pain and start utilizing more, especially among surgeons, because I think there's too much spine surgery that is happening and other musculoskeletal procedures where patients don't need. And I think we need some better education for that. But at the same time, what I always say is that the physical exam, the history, the imaging, everything has to line up before you can say, okay, this is the problem. Sure, you could have a disc herniation, and I've had patients, I'm like, that's not your pain. That's your scoliosis is not causing your pain. Sure. So yes, more education with understanding pain is better, but I don't agree that doctors don't know about pain. I think we know a lot about pain. It's about educating all the providers out there on how, especially spine surgeons, on how to talk to patients.
I think that sums it up pretty darn well, and I want to end it on that note, that we hear what Alan is saying, and there is definitely some evidence-based information out there that certain pain with proper guidance, call it psychological intervention, if you will, but in concert with what we learned in medical school about pain and structural issues, I think it's a meeting of those two schools, meeting of the minds. There's always room for a balanced approach. There's always room for improvement, and there's always room for more research and study. But Alan, I think you're onto something there, and thanks again for sharing that with us. And Dr. Melamed, as always, a pleasure to have you.
Thank you, guys.
Thank you very much
Thanks for having me.
Thank you.